Yes, I'd like to ask about the report today, the briefing to the Royal Society of Canada, talking about the fact that a group of researchers believes that at least two-thirds of the deaths caused by COVID-19 outside of long-term case counts in long-term care may have been missed, and that, up to 1,767 people died in BC, above what would be expected, according to this policy briefing. And they blame poor data collection and inadequate recognition of the impact of COVID-19 on low-income and racialized communities. So in light of that, is there anything that you or your office will do to collect data in a different way?
So I think we need to take that review with a grain of salt, because we have, as we've presented a number of times, we have an ongoing surveillance system where we do look at total deaths and deaths by cause here in British Columbia, and we've presented that a number of times. And very early on in this pandemic, we had an arrangement with the coroner's service. We worked together to make sure that any sudden unexpected deaths in the community were tested for COVID. So I don't agree with what that report has come out with, and I think there are variations that they have made assumptions between what happened in Ontario, for example, and what happened here. Undoubtedly, there are some deaths that we missed early on. It's just a function of the testing capacity, but we also know from the work that we have done, the surveillance that we've had over the last 10 years, that we continued through this pandemic, that the vast majority of deaths that we saw were related to COVID in older age groups, and related to the overdose crises in younger age groups, and we've presented some of that data. As well, there are unexpected deaths in the community that are related, we believe from the data that we've looked at the BC CDC, more to people not seeking health services for other underlying conditions. So not directly related to COVID, but more related to people who didn't access hospital services when they needed to. And we've seen that in the emergency department data, we've seen that in hospitalization data through that period of time. So this is absolutely something that we are continuing to monitor and change and to try and understand. And collecting data, race-based data, is a different issue. And we have collected disaggregated data by indigeneity from the very beginning, again, because we compelled the linking of databases with a partnership with the First Nations Health Authority, and also a partnership we have with Métis Nation BC. So those data we have been following very carefully, and we have a good understanding of how the pandemic has affected Indigenous peoples in BC. What we don't have is a case-based data collected by race, and that is not a question that we asked directly every single case from the very beginning. And we are absolutely working and with our colleagues across the country to find other ways of understanding the impact on different communities. Because, as you can imagine, when somebody has been diagnosed, particularly early on, with a new infectious disease, some of those questions are not that important in terms of us understanding how to react to the pandemic. They are absolutely important in helping to understand the inequities and the impacts on communities, and we have other ways of finding that information, including things like the surveys that we have done. So absolutely, we want to be able to more systematically understand the impact of the pandemic, but also the impact of the measures we took to manage the pandemic on all our communities in BC, and we are working on that.
Premier Horgan, I just want to come back to what you said earlier. You called BC's results during the pandemic extraordinary compared to other regions in Canada. Is it fair to say that, given the report on excess deaths that just came out today? I know Dr. Henry addressed it, but can we really call just under 2,000 and potentially hundreds more deaths an extraordinary result?
The data, putting aside the report that Dr. Henry spoke to, the data is overwhelmingly supportive of that position. The fatalities, which was our objective when Dr. Henry and Minister Dix first briefed me back in January of last year, our objective was to keep as many British Columbians safe and alive as possible. And as regrettable as it is and tragic for families to have had 1750 plus people pass away, over 11,000 in Quebec, the next closest of the jurisdictions of our size, of 5 million people in North America, the next closest to the low mortality rate is Ontario, and their mortality rate is twice what ours is. So I think it is a fair statement to make. And I know that it's undeniable that, as Minister Dix just said, our already stretched healthcare system, because of the opioid crisis, because of the other challenges that we inherited when we came to government, has done extraordinarily well because of the people, not because of government policy, not because of anything I or Minister Dix did, but because we had a public health office staffed by Dr. Henry and an extraordinary team that went to work immediately to protect British Columbians. I'm very proud of the work they did, and it is undeniably a superior outcome to other jurisdictions in Canada.